Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me is...
Maddie Norton.
Maddie, it's April.
It is.
As we're recording this, I'm actually experiencing some showers.
I am as well.
We'll have to have some flowers behind us for a May episode, I think, just to tie this together.
Mm-hmm.
Well, before we get really launched into our April theme and start digging in, can you tell us a little bit of an overview of what's going on this month?
Yeah, so we will be having AFSPA Live on April 30th, I believe, the last Thursday of the month, either way, at 11 a.m. Eastern Time, so always can look forward to that. And in the meantime, we have a couple of Prudential webinars going on. So we have the Financial Wellness Checkup on the 15th, and then on the 21st, which is a Tuesday, we will be offering a webinar called Is Your Financial House in Order? So if you're thinking about your finances, since April is tax month, as people say, definitely check that one out. It's on April 21st, and you can choose 3 separate times to register, and you can register at afspa.org/events.
That's right. And I just submitted all my tax documentation yesterday as we're recording this in late March. So fingers crossed everything's in on time. That's right. Yeah. I'm still on time. Hopefully, if you're listening to this in mid-April, you've already done that, or at least gotten the extension. So but it might be good to tune in for that Financial House in Order one either way. Now, we're trying to keep ourselves focused this year, both literally on the topics we're discussing, but also alliteratively.
Yes.
We had, Financial Wellness February, Medicare March. What is April?
This month is all about AFSPA.
All right, I like it. Three A's in there, and then we add April. All right. So we've done some episodes in the past that have focused on ancillary programs and diving into those. And of course, a lot of our episodes look at specific programs, either our ancillary or specific partnerships we have under Foreign Service Benefit Plan on their own. But it's been a while since we focused just on Foreign Service Benefit Plan broadly. So that's what we're going to do today.
Yes.
Yeah.
And as a bit of a spoiler, we will have another episode this month focused on claims processing for FSBP. But today we're going to be visiting some of the most frequently asked questions and discuss topics that our health benefit officers encounter. We have a special guest with us, and he has joined us for a past episode. It's Igor Cherevko, who is AFSPA's Senior Director for Health Operations. And the first part of our interview will help us dive a bit more into his background. For now, we'll say that he has been with AFSPA for 10 years and in his current role for 15 months. Prior to that, he led our research team and served as interim lead for the telephone operations. And he previously worked in quality assurance and as an HBO on the telephones. So let's get started. Let's jump into it.
Absolutely. Igor, welcome back to AFSPA Talks. Thanks so much for joining us today.
Thank you, Kyle. It's great to be back again at AFSPA Talk. I'm really glad to join you again. I appreciate the invitation, and I am looking forward to our discussion today.
We are so excited to have you, Igor. And we know that you have a big team at AFSPA with more than 60 staff members that report to you. Can you please tell us the various teams that make up health operations?
Oh, okay. Health operation is made of 5 core teams. And these teams are the telephone team, the direct billing and communication team, the quality assurance team, training team, and research team. So the largest of those are teams is telephone team, which serves as the front line of our organizations. They are the first point of contact for the members, handling inquiries, different inquiries, providing support and helping guide throughout the benefits and services. I am also pleased to share that we are currently expanding this team. We have 14 new trainees in process, and we expect them to be fully onboarding approximately mid of April. This growth will significantly enhance our ability to support our members by reducing wait time and improving overall service efficiency. Also, in addition to the telephone team, we have our direct billing and communication team. This team manages all correspondence we receive from our members, whether it is by email or by traditional mail. They also, the team, oversee our direct billing operations. Working closely with international hospitals and serving as a key link between those providers and our members. They do an excellent job enhancing communication, and so they are doing a very great job. In addition to that, we have quality assurance team. That team plays an important role in supporting our health benefit officers. This team reviews performance, identifies trends, and highlights areas where we can improve. They also help keep the team informed about updates, benefit changes, and best practices. So we continue delivering high-quality services. Another key area within health operation is the training team. They are responsible for preparing and supporting our health benefit officers. So this team reviews performance, identifies trends, and highlights areas where we can improve. They also help keep the team informed about updates. And lastly, we have our research team, which is a vital resource for entire department. They assist with more complex and unique questions, inquiries from the member, and research team help to find accurate answers. They also work closely with our partners, so which are our plan administrator Aetna and our pharmacy partner Express Scripts to ensure we provide complete and reliable support to our members. So these are five subunits, subdepartments of the entire health operation team.
And Igor, in our intro, we shared briefly about your role and your history at AFSPA, including, I think, some time working in each of these areas, including leading the research team most recently before your promotion to senior director. But you haven't been in AFSPA your entire career. So I'm wondering if you could tell us a little bit more about your background and what brought you to AFSPA, just to give our members a little picture of who is helping them and who's leading the team that's helping them.
Okay, thank you, Kyle. So my professional background is rooted in service and problem solving. My legal education has provided me with the strong foundation of understanding of complex issues and solving problem efficiency. Before joining AFSPA, I worked for 17 years at the American Embassy in Kyiv, Ukraine, and I worked for American Citizen Services within consular section. My responsibility include assisting individuals with medical, financial issues, also American citizens who face in difficult situations. It was a role that required sound judgment, attention to details, and ability to navigate complex circumstances. Also, I wanted to add that working closely with the federal government employees during that time, it made my transition to American Foreign Service Protective Association feel very natural, and most of our members are also federal government employees. In many ways, the core of the work is similar, ensuring people receive timely, accurate support and that complex issues are resolved effectively. Now, in my leadership role, my focus is on overseeing operations, strengthening our team, and making sure we consistently deliver high quality support to our members.
In your current role, I think it's fair to say that every day is different. You might be helping an individual member. You could have a meeting with Express Scripts to review policy, engage with Aetna on claims statistics, or play a key role in our strategic planning at AFSPA. I think it's worth noting that you do still work with elevated member cases and get feedback from the team to know what's working and what's not, and what questions are coming through. So, what are the most frequently asked questions or most often discussed topics when members contact us besides Encircle RX?
Yeah, definitely Circle IRX is the most frequently asked question, but we often also get questions about drug coverage beyond the changes in cost sharing in 2026. Also, as you know, plan uses a formulary, and the formulary can change as new drugs are introduced and prices changes. There are drug directs excluded from the coverage, but there is always an alternative available. Medications are excluded from the plan formulary are generally not covered by the plan unless they are approved through the process called formulary exception. So in order to request formulary exception, the prescribing physician has to submit a letter of medical necessity to the Express Scripts or to the plan to us, and we will route for processing. So this letter has to state that all alternatives were tried, but they were not effective. So therefore, through that process, the medication that is excluded from the formulary may be approved. Also, the latest list of drugs is available through our partners at Express Scripts, and you can check the cost of drugs through the pricing tool at FSBP website.
Absolutely. And we'll post a link to the drug pricing tool in today's show notes. Hopefully that's becoming familiar to people. On the topic of prescription drugs, do we get many questions about prior authorizations?
Yes, we do have a lot of questions about prior authorization. And as you know, the more drugs are requiring prior authorization these days. The prior authorization only be completed by the prescribing physician, and it is often require additional documentations. Express Scripts typically contact the provider's office when the prior authorization is required or needs to be renewed. But they may move more quickly when our members can call them directly and request expedition services.
One of the most frequent reasons members contact us is to ask about claims. So let's talk about claims for a few minutes. What is the deadline for members to submit claims?
Yes, the claims is also another most frequent questions that the member have. Almost 80% of the calls we receive from our members are either its benefit coverage or the claims. So talking about the deadlines for the claim submission. So under the Foreign Service Benefit Plan, claims should be submitted by December 31st of the year following the year in which you received the service. Submitting your claims within this time frame helps ensure prompt and accurate processing. We also understand that given recent global events, there may be circumstances beyond your control, such as governmental administrative delays or legal incapacity, that prevent you from submitting the claim on times. Prevent our members submitting the claims on times. In this situation, we encourage our members to submit claims as soon as reasonably possible, along with the brief explanation outlined the reason for the delay. We will carefully review all the submission and take the appropriate step to process the claims, members' claims. Also, as always, we encourage our members to file the claims as soon as possible to avoid delays and ensure a smoother experience. And of course, if our members have any questions regarding claims, they can always contact us, and we are glad to help them.
Absolutely. And I will add that if we need additional documentation to process the claim, it is easier to get that from your provider closer to the date of the service than it is a year later. So, Igor, I appreciate your encouragement to file as soon as possible. I'll also add that if you're in the US and going to a network provider, they may have negotiated a different timeline than with our network provider. With that being said, let's look at the other side of claims, though. So a claim comes in on time. How long should members expect before the claim is processed?
Okay, we have been averaging right now 21 days for both domestic and overseas claims for the last year. This is longer than they were we've seen a year, years past. And our partners, Aetna, is working hard to keep that steady and even bring the processing time down. So that said, please be patient. That is message to our members. Please be patient with us. We are trying to do our best.
All right, let's spend a little time on coverage that is somewhat unique to FSBP. We get questions about coverage for intraocular lenses. What is this and how do we cover it?
Yes, so there are so these are artificial lenses that are an upgraded or premium option that may be offered as part of cataract surgery or other procedures. In order to we encourage our member to discuss with the doctors about that option available, and we cover this service. So basically, FSBP is one of the few plans that covers the premium intraocular lenses, including a multifocal, accommodating, and toric IOLs. So these are covered under orthopedic and prosthetic devices coverage per our brochure. This is section 5A. Because coverage is not typical, some providers may ask our members to pay upfront. So, and members for this portion of premium lenses. So, members can pay upfront and then submit the claim for reimbursement. And as I mentioned previously, it will take us approximately 21 days to reimburse members.
As part of our discussion, we should touch on current events. We are recording this in late March, and this episode will come out in mid-April, but even then, I anticipate we will have hundreds of members who are still being directly and indirectly impacted by events unfolding in the world, particularly in the Middle East. Some have been evacuated to the US or to a third country, and others may still be at their post. This can mean an increased need for mental health support. What options do our members have?
Yes, being overseas, members can utilize Lyra Health for urgent and ongoing support. So this is telehealth consultations that are available to our members outside the 50 United States through our telehealth vendor, as I mentioned, Lyra Health. This is our telehealth vendor. Members have to access telehealth. They can access 24 hours, 365 days. They can do it either by their website or by calling the number. So this information are available for our member, and the instruction how to access Lyra Health in our brochure, plan benefit brochure. This is section 5E, page 79. Also, other members have had long-term success with the Truman Group. Their services are designed for ongoing longer-term care rather than immediate short-term needs. And as well, so if members choose to use Truman Group, they can access their information through their official website, trumangroup.com.
And we'll make sure to put links in the show notes. Igor, I know we've only scratched the surface on the topics we could address today, but to keep the episode manageable, we'll plan to close here. Before we go, do you have anything else you'd like to add?
Maddie, you're right. There's certainly a lot more we could discuss, but as you mentioned, to keep the episode manageable, this is a good place to pause. I want to thank you again for inviting me to join AFSPA Talks. I'd also like to encourage our members, so in case they have any questions or need assistance, they can reach out to us. We are always happy to provide support and guidance to our members.
Thanks again to Igor Cherevko for joining us. For more information on the Foreign Service Benefit Plan, please visit afspa.org/FSBP and check out all the links in today's show notes. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this program is meant to be educational. The views expressed by the hosts and guests do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA and its partners, the policy provisions will prevail. Thanks for listening, and be sure to subscribe to AFSPA Talks on your favorite podcast app to catch all of our future episodes. Please rate and review us on your favorite app, and stay up to date on all things AFSPA on Facebook, Instagram, and LinkedIn. Look for @AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.